I'll talk about my mom. I grew up knowing her that she doesn't like watching any movie. Let me be like Indian movies where they need to write at the bottom.
Mm.
And I used to think that, oh, this was just a normal phenomenon. She doesn't just like to watch movies. But when I grew older, I
Subtitles.
became an optometrist. I realized that she was really myopic. And then I started asking questions. I discovered that she has been myopic right from when, as long as she could remember. Maybe she was when she was like 5, because she has never sat at the back of the class. She said she always likes to sit in front.
So she can see the board
So that she can see the
properly.
board, and that she practically does not even like to watch a movie, because if she must watch, she has to go very close to it, and then they have to chase her back. But she never knew this was myopia, because the knowledge and the awareness that we have today wasn't then available. And to believe that I did her first glasses as a child. That was the first time she was wearing glasses, and I could see the smile on her face, because she has never worn glasses. She finished secondary school. She was even a teacher up to the level of being a principal, and she never even knew that she had myopia, because to her it was just a normal. The best in life. It looks like there are so many children wearing glasses today is because of the awareness that have been created.
Okay, Adlin, you want to add something to it? Because I'll put this my story. I remember growing up while I was younger. There were times where it was difficult for me to see the board from far. All right, but then the only question I asked myself is why can I not see it? And then I just forced myself to. What I'm trying to get at is I forced myself to want to see it. Eventually, at some point, I just discovered that I could then see from far. I remember some people would come to school. Then there's a thing that they do. They would have letters written, and then they'll have it far, and then they'll have you sit back and like, which can you see and read stuff and all of those things. And the thing that kept occurring to me at the back of my mind growing up was, how do people get these things, especially kids? Like, what goes wrong that then a child that doesn't smoke or doesn't consume alcohol or any of those habits that you think might, and then suddenly you just say that, oh, child was seeing well before, at one point in their life at the early stage they can no longer see near or see far. What is there a cause? What causes it?
Okay, for every child, for every human being born, everything that has to do with growth, it has to do with growth. The Azialen, that's the growth of the eye, and the growth, which has to do with gene. So everybody comes with his own eyeball size and eyeball formation. So for children who are growing, gene plays a role in everybody's life. So you can see that was brought us to the World Sight Day advocacy and everything, to create awareness for people to get to know that eye problem like refractive errors are something that one should take care of from onset. So for children, you remember those days when people have to have half past for eye, what they call half past for eye. So now it's no longer rampant because the awareness has been created, so that squint and that deviation is no longer there. So because everybody grows with one genetic factor or the other, the size of the eyeball, the shape of the eyeball. So as activities increases, astigmatism might come in because the deviation of the eyeball, has to it becomes obvious, and then people tend to notice that, oh, I'm no longer seeing the way I was seeing before, or my vision is no longer as clear as it's meant to be. So then for people like myopic patients that she has explained, just like her mom, what happened is that when they notice that they cannot see at far, they tend to be indoors. They tend to do the little activities they can see just within their cycle, just for them to be comfortable without even looking towards getting their eyes checked. So the awareness today as World Sight Day is for people to find a way to visit any eye clinic, visit the optometrist and find a way to get your eyes checked and try to prevent those avoidable issues that can be treated and managed on time. So refractive errors like myopia, hyperopia, astigmatism, then at a certain level in life, no matter how it is, for every human being existing now, because of the phones, the systems and every other thing we're exposed to, presbyopia will definitely set in. Everybody is reading and writing presently. So once presbyopia set in from 40 years and above, just find a way, visit the clinic and get your eyes checked so that you can enhance your reading within your circle, enhance your reading and make it visible for you to see better.
So are there healthy habits that people can imbibe to lengthen the health of their eyes or keep their eyes healthy? I think, what if there are, what are those habits that people can cultivate?
Okay, the habits one can copy is just about eating healthy, and then
That part get us a bit.
eating healthy.
We say eating healthy, like, but what is eating healthy? Because to some people, drinking Gary and eating.
No, for
Dr. Oreva
everything
is
there
laughing.
should be proportional.
So
That should be level to it.
so how do we? What would be termed from the perspective of an optician? What would be termed eating healthy for the sake of the eyes?
Okay.
Okay, so you need your colors. I call them your colors. Your green leaves, your fruits. Those are some of the things that Nigerians don't like.
It costs.
So
Let me say we know like it costs. It costs.
so I always tell people that there are fruits that are always in season. So what you do, you go for fruits that are in season compared to those that are not. So I can't be at this point now looking for mango because I know it's not in season. But there are fruits that are in season. There is avocado, there is cucumber. Then we have our vegetables that are very cheap. That are in the market with 100 naira, you've gotten enough vegetable.
You see, Dr. Adlin told you like, 100 naira, not vegetable. Where are you buying it? I need your plug.
Okay, so you can just get a little of this, that. You have your pumpkin leaf, you have your water leaves, you have your grain. Just put them together. They are very healthy for your eyes. And then I also talk about self-medication. Is a very common practice here in Nigeria. Those are some of the things that are not good. So I've seen firsthand, somebody came to the clinic and the person was like, I can't see. I don't know what happened to my eyes. And then when I looked at the pupils, they were fixed and dilated. That means I don't know how to explain it to the
You have to
simplest
have a
one.
way home.
But
They are fixed.
the pupils supposed to be very small at the center. It's almost white, covering
Okay.
everywhere. And I'm like, what happened? Did you use any medication? Did anything happen to your eye? She was like, oh, there's a medication they gave to my mom. I said, let me quickly use it. And then she didn't know that she kept her eyes dilated. So I told her this medication would take like 2 weeks to leave your eyes. This is the result of what happened. So we don't just assume that, oh, because I was given this the first time, this is what I'm supposed to take again. So those wrong self-medication is also not good. And then
Okay.
so people don't check their eyes. And I remember coming on air like this one time and someone called and said he's 48 or so and he has never had an eye check. So when we're talking about love your eyes,
I've never
you
had an eye
have
check.
never had
so-
an eye check and you are 20, you are 40, what do you expect? You're not caring for your eyes the right
I've
way.
never had an eye check.
You've
I'm
never
telling
had
you
an
now.
eye check.
Ever. I think the last time will be primary school.
And if I ask, some people will say it's expensive, but when we look at them, they are wearing Gucci shirts, like Andrew is looking
Leave
up,
that
touched
one.
up,
Let's
and-
go for a commercial now. But we'll go for a commercial. When we come back, we'll talk more about this and then we'll open the phone lines. I'm pretty sure a lot of people have questions that they want to ask. Stay with us, Nigerian. The conversation continues. Good morning. Dr. Adlin, Dr. Oreva with me in the studio from the Nigeria Optician Association. I hope I got that well.
Nigerian
Optometric. Oh, this is not association. We've had issues. All right, Nigeria Optometric Association. And they've been saying quite a lot about World Sight Day, which was actually yesterday, but the campaign for it continues. And I'm hoping you're learning a few things about the eyes. We'll open the phone lines, though, and then get your questions to come in and also contributions. But before we went on the break, I remember asking us, those of us who are listening, to get on Facebook at Nigeria Info 92.3 PH and share this with us. What do you know about how to care for your eyes? Do you know anything at all whatsoever? Because I feel like there are many people that don't even know. Some people put salt and water in their eyes. Some people put sugar and water in their eyes. Some people put if you hear some things people put in their eyes, they don't put pepper for our eyes. All of this to treat whatever we don't know. So what do you know about how to care for your eye? Let us know. Send that to us on WhatsApp at 0809-030-6416 or you get on Facebook at Nigeria Info 92.3 PH. That's the handle, Nigeria Info 92.3 PH. I'll come back to my guest. Before the break, we're talking about diet and how diet can affect your sight. And you were saying a few things about things that we should consume more that's going to help improve our vision. Now, some people will say that some of these things that you have mentioned are quite expensive. Like, I have a friend whose child goes to school. They need to buy fruits almost every day. You must have, sometimes they have berries, sometimes they have grapes, sometimes they have this. And then one day the guy just sat down and was doing the math for the week, how much he's spending on getting these fruits. And not many people can. Are there any other local remedies or easy go-to things that can help people? They say eating too much gari too is not good for the eye. Please, is that myth correct?
It depends on the context in which you're coming. Like we said, we're talking about carbohydrates and all that. You shouldn't just take carbohydrates. You should take a balanced diet. They should take a balanced diet. That's the whole idea. And then I was talking about the fruits and the vegetables, like you talk about. Less fruits may be expensive. I agree with you 100% that it's
Dr. Oreva, it is not maybe. It is expensive.
Yes, it's expensive. But like I mentioned earlier, go for fruits in season and then take the little that you can. You know, you're mentioning berries. Those are fruits that we practically have to import. We're not growing them anywhere. So why should we go for that? What happened to our own papaya? That is pawpaw. What happened to that one? That one is just by our backyard. You could plant them. What happened to pineapple? What happened to our oranges? Those ones are a little bit more affordable than going for raspberry, blackberry, apples. Those ones are expensive. Yes, they would definitely be expensive. So you go for those ones that we can get, that you can practically plant. Our guava, our tangerine, those ones are readily available. I buy tangerine like 5 for maybe 1,000 naira. And it goes a long way.
Okay, so now you get the cheat code. You can buy the very easy one. What harmful habits, Dr. Adlin? Are there any harmful habits that people should avoid if they want their eyes to stay healthy?
Okay, for your eye to stay healthy, you need to avoid something, any trauma at all that can lead to any eye challenge, any like the normal fight blow. You know, the first target is to blow the eye.
Yeah, at secondary school, that's
I don't
the
know
move.
what people have to do with the eye.
Blind in Naka, no fit see.
Exactly. Then for wearers, try to wear your protective frames, protective glasses. For what's it called? Swimmers, try to wear your contact lens to protect your eye and wear your goggles.
So the water going into the eyes does it have
the chemical they use in treating
the water? Okay.
Do have, so people need to wear the swimming goggle, you know, to protect the eye. For people who work in different places, they know their safety gear that can trigger. And then for the parents should avoid putting urine in children's eye.
Apollo, they cure Apollo now. So that's what they said.
It doesn't cure anything. It even causes more harm. Good. All those substances they put. Somebody tell you rub 1 cent leaf and put the water. It will clear off.
Bitter leaf water.
and
drop in your eyes.
put ogo leaf, squeeze one ogo leaf and put, and all that. So it doesn't make sense. People should avoid all those means, and then try to visit the optometrist once every 6 months, once every 3 months. Visit the clinic, check your eyes, have a good eye check, and then get your eyes treated. If you have any infection, visit the clinic. Don't avoid self-medication.
But traditionalists would argue with you, or what do they call them? Traditional doctors would argue with you to some degree with regards to the herbs and because some of them will make the argument that our forefathers used to use some of these herbs to treat their eyes, and some of them were seeing very well even in their old age. Their vision was still intact.
Actually, there was no yardstick for them to say that they were seeing very well. They were only making do with what they could see. There's no yardstick to say they were seeing clearly, and we can't say for the fact they use those things that's the right thing to use. The awareness has come, information has made it clear that these are harmful to the cornea, they're harmful to the eyes. They can cause more harm than good. So many people have developed cataract and other symptoms because they are putting other substances that are not good for the eye. So avoid all these things and then have your eyes checked.
Let's take a few calls now. 0817-923-0007. You can also call 0817-923-0002 or 0817-923-0003. I just saw a message here, which brings me to this question I wanted to ask before we go to the message. There are some people who can open their eyes underwater and some people can't. Is that a thing? Like, is there anything special, particular as to why there's a difference? Primary biology used to tell us it's just reflex. Some people can do it, some people cannot do it. Is there any other thing beyond that that's responsible for it, or is it unhealthy for people to practice that?
Okay, so I'll say that when it comes to tolerance, different people have different threshold. So what I may be able to tolerate, you may not be able to, do same thing, like you rightly said. So that somebody was able to maybe open their eyes, stay underwater, does not mean that someone else will be able to do that for the same minutes. But when you swim and water continuously gets into your eyes, you see some of them come out with red eyes, like inflammatory, have inflammatory reactions on their eyes. So like my colleague rightly said, if you want to swim, if you are wearing contact lens, because contact lens and water, they are not friends, you take off your contact lens, you could wear a safety goggle if you need to open your eyes underwater. So that is why you see professional swimmers, when they want to swim, they wear a safety goggles that covers their eyes completely so that they can open their eyes underwater, because when you stay so long underwater with your eyes open, it may get irritated. And then sometimes you never can tell, there may be some chemicals or some debris or anything that may have fallen into the
bacteria
water
and
that may not be good for your eyes. So you need to keep them protected.
All right, because this person says, I always allow water to get into my eye while bathing. That's the reason why I had to ask that question, Tony. This one says, good morning. I've noticed that my two sons, age 11 and 9, blink their eyes intermittently. The older one now uses glasses. Recently, I observed that the blinking became more frequent in the younger one. Though it has since reduced, we plan to use an optometrist this weekend. However, I would like to know what could be causing this, possible underlying issues, and how to prevent it. Kalio from Bonny Island.
Okay, Kalio. Sometimes when people blink, it's because they are trying to clear a blow. So if I'm not seeing something very well, I'll try to blink to see if I could make it better. So if you discover that you said the first one was blinking, and at the end of the day when you went to the optometrist, possibly they saw a refractive error. That's why the child is wearing glasses now. So it could be happening to the next child. Sometimes it could be an irritation. Children have the way they react different from adults. They may not be able to express themselves very well. If the eyes are itchy, or maybe the eyes are irritated, or they feel dry or peppery, the child may want to blink. So I would advise that he's already on the right path. He should go straight to the optometrist, have the eyes examined, and know exactly what is happening, because what we can do is just speculations. But you may go there and there are other underlying factors that may be discovered, and you'll be helping that child.
Someone says, I want to ask your guest. I used to have some eye pain sometimes, and my eyes will become red. Someone told me to put salt water, like as if I knew. and put my eyes in it for a few minutes. And if I do it, I'll get myself. Is it a good practice?
Actually, it's not a good practice. Salt water cause doesn't clear off pain and red eyes. You need to visit the optometrist. You never can tell what is happening there. If there are underlying cases, if there are issues with the optic nerve head, if there are issues with the what's it called? The media that is causing the redness. So you never can tell what exactly is happening there. So visit to the optometrist will help you be sure of what exactly is happening and get your eyes treated once and for all instead of the normal practice of salt water.
Right. Magnus in Mile 3. Good morning. Let's hear you. How are you, Magnus?
Thank you so much, Mr. Andrew. I want to parents tend not to take care of their, kids properly when it comes to eye. You see some parents giving their children some food, some medications, already know they want to get their children or their kids fat. They want to make them plumpy. They want to do this so that they can look fine. For not knowing that those things they are giving to those children are destroying them, especially when it comes to the eyes. So I want to encourage the parents that they should mind things they give to their children. In as much as I also agree that most of these things are hereditary, and so guests have rightly said. So then are self-inflicted, caused by the parents. So parents watch they are giving point in time because sometimes it might cause havoc to their eyes. Thank you so much.
All right, Magnus, thank you. Ida from Nkoro, good morning. Let's hear you.
Good morning.
All right, go on.
Yeah, I greet our guests in the studio. I remember when I was small, when we have Apollo, we normally go to salt water to open our eye. And before I see that Apollo will clear. It's too much reading, morning and night, that affect the eye. And drinking of too much gari that affect eye. Because normally, if you have Apollo, when I was small, you go inside salt water, open your eye, that Apollo will vanish away. And the eye drop that they are providing these days from anywhere is that it's not helping the eye. It's destroying somebody's eye. Somebody got an injury. Was last week, put eye drop. The two eye was, I don't know. So I don't agree with your guess. So that is to help also. Thank you.
All right, Ida, thank you. Let's hear from Andy. Then I guess we reply to Ida. Andy from Alakaya. Good morning.
Andrew, good morning.
Yeah, go on, please.
To you and your guests in the studio.
All right, go on.
Yeah, Andrew, I must have to say very big thank you to you because I am happy that your station do not only talk about politics. I'm even happy and I'm surprised that there is no traffic at all this morning because nobody has been trying and trying. I just tried once and I got it. Kudos to you. Let it not just be politics alone. These are some of the things that we are looking for. I want to ask your guests because what I want to ask is just for the public and the masses who are listening to you. It's your own medication as cheap, as easy, as affordable that any normal man around this environment can also contact you to get. That's just my question. Thank you very much and God bless.
All right, Andy, thank you. The numbers still are 0817 923 0002, 0817 923 0003, or 0817 923 0007. All right, so let's respond to him and then to Ida before we take more calls. He says medication. Is it easily accessible? Is it affordable? And is it available? Ida says, salt water declaring eye. This thing one that they talk. Nah. And then he also raised questions about eye drops, talking about experience somebody has. So, which means we have fake. That's the best explanation that we can have for those situations. Do we have people that do adulterated products and then they have it on the shelf and people use it and then get what they get? So let's hear your thoughts.
Okay, so I'll start with Ida. Apollo, let me use the word you used. It has its own name. Is most of the time self-limiting. By self-limiting, I mean that you may not even need to do anything sometimes. The body has its own way of fighting it off. It's not your salt water that did anything. It doesn't do anything. Because these topics you are talking about are things that have been done as project topics, both at the university level, at PhD level. People have tried it. Let's try this, try that. And then there are facts that have been proven that this salt water, urine, all those things, they don't breast milk, camphor, they don't do anything. You know, sometimes people just feel that when they put in something and they feel a kind of hotness, it has gone. Even if you didn't put that in, if it was in mild form, it would have gone on its own. I can assure you that. So why people do come to the clinic is when it has passed the part where the body could no longer fight this. It's now becoming a serious thing to you, and you discover that you are not feeling pain. Your eyes are all covered in mucus and all the like discharge now. And then that's when people will now say, okay, let me go to the clinic. And then the medications that you are giving, except you are giving medications from a quack, a standard optometrist or any eye doctor that has gone through the forwards on you will not give you an eye drop that would make your eyes worse. Most of the time, people end up in quacks, in the hands of quack, and then they feel, oh, I visited a doctor and my eyes went blind. If it is a case that there are different levels, if it's a case that, okay, needs more further care, you'll be given care depending on the level that it is. But I don't want to agree with that maybe it's an eye drop. Probably the person went somewhere else, and then the person that you visited may not necessarily be the right person. And then to your... So we know that from time to time, people do certain things, they may not be able to pay. I know this year alone, I know some philanthropists, like yesterday, we partnered with Lions Club, we partnered with Rotary Club of Port Harcourt GRA, we partnered with Rotary Club of Cosmopolitan. There are a lot of...
But however... Would it be right for people to say that they don't, like you're saying now, that, oh, it was free, it was for the week, they had instead, but many people would say they didn't hear it. Perhaps there are many people that don't even know about the World Sight Day. Don't you think that has something to do with the dissemination?
Okay, World Sight Day is
that?
celebrated every second Thursday of October every year. It doesn't change every second Thursday. And from Monday, they have been on air in different other stations telling people places they could go to. We had a road walk announcing it on the street where you could go to and all that. So if you didn't hear, it's really quite...
Oh, you're not on your radio that time.
And then we also opened up all our clinics everywhere for free eye check. And I know, like yesterday, we did up to 20 in just my location, right. My one clinic. There are other places, like when we had a screening in collaboration with Old Girls of Abuloma. We had over 300 people screened. So there are a lot of places that these things were given free and made affordable,
right.
Just for this purpose.
We have David and Goodness on the line, and we're running out of time. This message says, I had problems identifying foul object right from primary school. Couldn't see anything on the blackboard until I come close to it. I was later given glasses by an eye doctor after checks at my secondary school days. I've used glasses since then until I became 65 because I couldn't watch TV or drive without the glasses. Right now, I don't use glasses anymore and I see better. I drive without glasses. I watch TV without glasses. I changed my diet for fruits and more vegetables, also because of diabetes and high blood pressure. But suddenly, I started having better sight, thanks to God and a change of diet. David in Port Harcourt is on the line. Okay, Goodness from Eneka. Let's hear you quickly as a wrap up. Good morning, Goodness.
Good morning.
All right, quickly, let's hear you.
I have two questions.
Go on.
What other ways?
Goodness, we didn't get that question. The line is breaking. Something with the network from your end, I think. If you can, please repeat. Go on. Are you using any plug-in device? Are you speaking through earpods or earpiece or any of those things?
No, I'm not.
Okay, go ahead.
I said, apart from avoiding the causes or triggers of allergic conjunctivitis, what other ways can it be managed?
Okay.
And secondly, for a lens prescription of about -1 with a blue cord frame or glass lens, how often should that glass be used? Should those glasses be used?
Okay.
That's my question.
All right. Thank you. I'm pretty sure this one does not concern me. Everything you have said, the people that are the doctors here would respond to that. I'm guessing you heard that clearly.
Yeah.
Okay. So let's hear.
Yeah. Goodness, concerning your glasses, Your glasses are to be worn constantly, and then what you should check is how long you've used that particular prescription. If you use that particular prescription for more than 2 years, then you should visit the optometrist and have your eyes checked. You can't use a particular prescription for more than 2 years. As you grow older, your prescription changes, the axial length elongates, so you need to refract again and get a new prescription. Then concerning conjunctivitis has to do with something you are reacting to within your environment. All depends on what you are reacting to. One is that avoid those things that you are reacting to and try as much as you can to maintain healthy hands, cleanliness. You have to be sure that your environment is clean. You have to be sure that your hands are clean always. You have to avoid regular itching and touching of your eyes. Then visit the eye clinic to have your eyes checked and be sure of the type of conjunctivitis it is. There are different types of conjunctivitis. You can't just conclude it's conjunctivitis because you are having itching. So you just have to check your eyes and be sure of what exactly it is before you have any drugs instilled into your eyes. So you always have to be sure of what it is before you can put any medication.
All right, and Dr. Oreva, let's hear you as we go. A few seconds. Now, does the celebration continue even though the day is past and the week is ending? What's your advice to people?
Like you said, the celebration was actually yesterday, but I think there are still some clinics that are open that took their celebration to the entire week, maybe Friday, Saturday. So you could walk into any of the optometrists clinic and then tell them you're coming on for what side day you want to have a free eye examination, and then you will be examined. But for the outreaches in different locations, I think that is already over.
All right. Thank you very much. We have to wrap it up here. My name is Ifiemi Andrew. Good morning. Have yourself a great weekend.